What's Up, Doc Mike? Public Health on Call, by Johns Hopkins Bloomberg School of Public Health. Today's topic for February 8, 2021, an update on COVID-19 in Brazil. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, we head to Brazil, where I speak with Dr. Luana Araujo, an infectious disease physician and alumna of the Johns Hopkins Bloomberg School of Public Health. In addition to seeing patients, Dr. Araujo runs a website devoted to providing accurate information about the COVID pandemic. Let's listen. Dr. Araujo, thank you so much for joining me. Let's start by you're telling me where you are right now.
Josh, thank you so much for having me. Currently, I live in Brazil. I live in a town that is called Belo Horizonte. It's the capital of the state of Minas Gerais in the southeast of Brazil.
Right now, you have studied public health. You are an infectious disease physician, and you run a website with good scientific information for people. What is the situation right now with the pandemic in Brazil?
Situation is probably the worst that we have seen so far. We have had this first wave that was massive. And then for some period, people actually adhered to all the measures that we asked for them to do. And we had some kind of results from there. But I think that from maybe 2 months, around maybe end of October or something like this, I think that because of the dream of a vaccine that could get here very quickly and all the tiredness that everybody is facing right now, most of the people just abandoned everything. So we are now facing a second wave that has been absolutely horrible. And we have, of course, Brazil is a continental country, so we have areas that are facing worse scenarios than others. But in general, we are not in a good position now.
Is the healthcare system straining to take care of the patients?
It is. We just reached 200,000 deaths. But that being said, we have an amazing health system. We provide universal health care for 211 million people. This is an amazing system with that finds probably no match around the world. We have a very strong primary healthcare system, so we could have had an amazing response, very different than the one that we actually had. And now we are facing UCIs that are absolutely packed. We didn't invest in mass testing. We didn't invest in contact tracing. So unfortunately, we left behind all the good things that our system has to offer and respond in a way that it was not meant to be. So yes, we are facing public and private systems struggle everywhere.
It sounds a lot like a country I'm familiar with here in the United States, where there is a strong healthcare system that hasn't really mobilized in the way you'd hope to prevent infections, and is now struggling in some parts of the United States with too many patients for the capacity. But I wonder when your colleagues call you as an infectious disease doctor and tell you what's going on. I know you also are seeing patients. What are they telling you is happening on the ground?
First, I would just like to point that there is a major difference between the Brazilian and the American health system, which is the free access to the point of care. So anyone that is living in Brazil has access to the health system and is able to be attended by anyone at any point at any time. So this is a major difference that could have counted in our favor, and it didn't. But that being said, all my colleagues that are out there are very tired and with very low motivation, because we keep struggling, we keep forcing situations, we keep going to endless shifts and this and that, and people are not obeying to the slightest advice, according to the latest science news and facts. So we see very complicated stuff. Our country has a young population, so we are seeing deaths in young people. We're not seeing deaths only in old people, as a lot of other countries did. We are being able to, as everybody else, to save more people that are in critical phases of the disease. But at the same time, we have a lot of people that don't have access to that, just because everything is so packed. So we are seeing entire families go. We are seeing kids that ask us to save their mom because the dad is already gone. So it's a very draining situation in a country that is not providing us with the minimum to perform our best duties.
That's a dismal picture. What do you think contributed to Brazil's challenges with the coronavirus? What were the key factors in not taking the path you were describing before, not broadly expanding testing, doing contact tracing, having strong communications? What would be the things that you'd point to?
Well, I think that first, it all became too political, and we were facing a very challenging political situation for a couple of years. And I think that the pandemic only made it worse because it was paved on a very tough educational system that we have. So for the past maybe 2-3 decades, our educational system has been destroyed, and that results in a population that is extremely vulnerable because does not have access to good information. And even when they do have access to good information, they cannot interpret that information in a way that they will use that in their own good. So it's very easy, it's very sad to say this, but it's very easy to manipulate our population. So when an issue like the pandemic becomes political, everybody is fighting for their own lives and not thinking as a society. So this maybe is the worst path that we could have ever followed so far. Individuals are facing their despair. And when you have a situation of despair and no knowledge, despair always wins. Emotions always win. So everybody is doing that. And science is not being heard. And when you think that science is being heard, somehow it also gets manipulated by someone else in politics. So it's very difficult. It's tough. We keep trying to keep our heads above the water, trying to do our best, but the results so far are not encouraging.
So we're now at a point where there are vaccines being approved around the world. Where does the vaccination situation stand in Brazil?
So we do have one of our prides, I believe, is to have an amazing vaccination system. We are able to vaccinate millions of people in one day. It's very strong, it's powerful, it's free. And people here are used to get vaccinated. We didn't have a lot of anti-vax movements in Brazil so far, but again, we are importing tough calls, right? Tough movements. So we now have 2 vaccines that are waiting for emergency approval. And now they are the AstraZeneca Oxford one, and the CoronaVac is the second one. They just did this, and they are going to be evaluated until this Sunday. So we believe that we can start vaccination by the end of January. Again, there are misunderstandings, there are misinformations around vaccines, even around governments that are publicizing those informations. So that this whole mess becomes a real challenge to the ordinary people to understand. So how will I take a vaccine that comes from a country that we don't believe in, and that's around China? That's the feeling around China. And how do I get a vaccine that is not, fabricated in Brazil, and how it's really going to protect me? And what do they want with this vaccine? No one knows anything about that. So I know that everybody else in the world is going through that as well. But when you take this kind of situation and put in a country that has a population that cannot consciously fight this kind of thing because of lack of education, again, this is very complicated. So we're talking about a movement that can help, that will happen. But I sense that we will have a lot of challenges as well.
I mean, in both cases, you're really pointing the finger at the information environment that exists. And I know you're trying to change that by putting information out. I wonder, and this is something I wonder about for the United States too, as more people get sick, as people see their friends and family getting sick, why isn't that having a bigger impact on people's understanding and behavior? Why aren't they questioning, the information that might have been erroneous before? I know some are, but it's in the United States, it's like a news story when someone does that. Like someone says, I can't believe I thought that this was like the common cold, because now people in my family have died. But, people write about that as a news story. It's not necessarily, though, changing behavior on a wide scale. I don't know if you've thought about that for Brazil.
Yeah, I did. And that's one of the things that I try to overcome with my website and how I write things down. But at the same time, I think that our situation is different from the US. I think that our population is too used to suffer. It's too used to a lot of health problems and violence and struggling. So this is just one more, At the beginning of all this, when people really were dying in, crazy numbers, people used to say, well, yeah, but, people died, more people died of tuberculosis last year than they are dying due to this. So why should I be worried about? Or more people died due to gun violence. Why should I, be aware or be careful? Everybody dies. We heard that from politicians. Everybody dies. So it's tough. I think that the key, at least for the small success that I have had, is to try to really adapt and customize that to the reality that they are living. So using their own words and posing that in a way that they really can internalize what you're saying, because otherwise it's just more information. And that amount of information they can have from anywhere else. COVID is a mass subject so far. So no one wants to hear about that anymore. So unless you have something really fresh in a way to say to them, in a way that they can really understand, they just don't pay attention. And this is what's happening to us.
It really speaks to the importance of people's expectations. Or do they expect that, they can overcome health challenges, or do they not expect to overcome health challenges? Whether they're optimistic about the future. I'm reading a terrific book by an author named Perry Klass about how in the United States, it used to be an expectation that many children died very young. And gradually over a century, it came to be the expectation that no child should die. And, while there was that expectation that children should die, they, all sorts of things were allowed. And now that expectation has changed, a single child dies and people say, how could that have been prevented? Which is an enormous amount of progress. But it is not something that is automatic and wasn't automatic. It didn't happen overnight. It was.
Yeah, it isn't. That's true. I wonder when this book describes this by happening when. at which,
Well,
the thing is that we are still going through that.
Yeah, it
right. Brazil is a low middle income country. I'm sorry, Josh. It's just like Brazil is a low middle income country that is very little known by the entire global health community. When you talk about low middle income countries in global health, you talk about Southeast Asia and Sub-Saharan Africa. You don't talk about South America. And that's a shame for us and for the rest of the world, because we here have all the struggle, all the challenges, and all the positive things that you can find wherever else in the world. So you have, for example, here we have this amazing health system. We are talking now about universal health care everywhere else, and we have it for 30 years. So this should be studied and understood. And now in facing this pandemic, how could that be more used or more, better used actually to achieve everything that we want to achieve? We have primary health care, which is the largest program in the world. We have community health workers, which is the largest program in the world. So why on earth aren't people listening to our struggle? Because that's the thing. It's not about having a universal healthcare. We do have it, and we are failing it. So I think that Brazil should be more inserted in the global health discussion, in the global health community. I think that we have a lot to learn from and a lot to teach. And I think that this is a very missed opportunity.
Well, I think you've made that case very powerfully. Thank you so much for joining me today.
Thank you so much, Josh. And I do hope that the next time we meet, things are going to be better.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.